in our blood, there are three kind of cells: WBCs, RBCs, and platelets. So anemia is basically decreased number of RBCs. That means red blood cells, or defective RBCs, which leads to decreased oxygen supply to all of the body. And means the red blood cells or its part, which is called hemoglobin, it RBCs, which travels through our blood. It transports oxygen, healthy oxygen, from our blood throughout the body. So it is basically a reduced hemoglobin, which is leading to reduced oxygen supply to all of the body. Anemia is caused more in children, most likely due to deficiencies in diet. They are not properly eating anything, and that is leading to deficiencies like iron deficiency, vitamin B12, folate. All these are required for proper production of blood in our body, and they are deficient, so it will lead to anemia in our bodies. Then they have malnutrition, kids. Then kids also have pica, which leads to worm infestation and all, which is also a common cause, which leads to children more prone for anemia. And then there are genetic diseases like thalassemia, sickle cell anemia, or some genetic disorders, which leads to faulty production of blood cells, and that is why it is more common in children. And the children, particularly which age group are more prone for anemia: 6 months to 2 years of age are more prone for anemia. Adolescent girls who have started menstruating are more prone for anemia. And poor socioeconomic background children are more prone for anemia because of lacking diet and worm infestations and all these. Types of anemia we can classify on basis of two things. First of all, severity of anemia. Roughly, we calculate that less than 11 hemoglobin is anemic. So when 10 to 11 is classified as mild anemia, then 5 to 10 mg per deciliter hemoglobin is moderate anemia, and if less than 5, it is severe anemia. This is basically a classification based on the severity. But and there is another classification based on the causes of anemia. So on the basis of causes, there might be three types. First is due to reduced production. Reduced production might be due to dietary deficiencies, with iron, folate, B12 deficiencies, or due to some systemic illnesses like long-term any illnesses there and the baby is not eating. So it will lead to whole production is suppressed. Then there is reduced production due to genetic disorders like pure red cell dysplasia, and these are rare disorders. Then second is due to increased destruction of our red blood cells. Increased destruction is basically due to the faulty red blood cells like thalassemia, sickle cell, you know. And malaria also can cause increased destruction of our cells. That's why in malaria also we go deficient in hemoglobin, and anemia is presented. Then third cause is due to frank blood loss. Blood loss due to any cause like worm infestation, which is very common in kids, hookworm infestation. Then and injuries, they are more prone for injuries, keep on falling. Epistaxis, that means the bleeding from nose, which will lead to small losses of blood, and which leads to anemia. Many times it goes unnoticed. Mildly irritable baby, pallor might be seen on examination of our eyes or fingertips on the babies. We can check for anemia. Then later stages, they might develop excessive irritability, poor feeding, weight not gaining weight. Then in severe cases, breathlessness is there, fast breathing. Their heart has to work more because of low hemoglobin. Heart rate is increased, and sometimes in severe cases there is unconsciousness also. In growing age, anemia has to be taken seriously. If any of the symptoms which I have told now, right now, they should get it treated, because in growing age, everything should be supplemented properly. If anything is deficient, is there is low hemoglobin, the growth will be hampered. So, free fatigue or blood loss or any other symptom like irritability, low appetite, you have to visit the doctor. And some severe signs, in that case, you have to. It is a must in adolescent girls. If there is heavy menstrual bleeding, you have to visit immediately. If there is any other systemic illness associated, you have to visit the doctor. First of all, we need to get the baby and check him physically for all the signs and symptoms, for examination in eyes and nails, and their organs has to be checked by the doctor. That is, their liver or spleen might be enlarged in some reasons of anemia. Then we have to take proper history of what is the baby's diet. Is he following balanced diet or not? Then in tests, basically we have to start with the basic complete blood count. That means hemoglobin and red blood cell count and other related indices has to be checked. What kind of anemia is there? Then we will check for iron levels, B12 levels, folate levels. All these levels will help us to go through the cause of the anemia. There are a lot of causes. If we have to look for any bleeding manifestations, we might need to get the stool test done to look for any blood losses. Then ultrasonography, that means sonography of the abdomen might be needed for any blood loss or any associated illnesses. Treatment will be related to the cause. Whatever is the cause, we have to treat. Whatever is deficient, we'll supplement that. First of all, we'll advise diet rich in iron, folic acid, all these, whatever things are deficient. Then we'll supplement oral iron. Then we will supplement B12, might be oral or IV also. That means injectable form, maybe if it is severe. In severe cases, in severe anemia, we have to give blood transfusions also many a times. Then if there is extreme cases of any genetic diseases, then bone marrow transplant is the ultimate treatment. Best way to avoid anemia is diet. You have to provide proper diet, proper things, balance that, what we say. It should be containing each and every nutrient as per the daily required nutrient, as per the recommended daily allowance, what is advised for that age group, and they should receive it. Then they should, proper hygiene has to be maintained to avoid any worm infestations. Then injuries has to be avoided to keep the baby safe. That is very important. It goes unnoticed, but it is very important part in the small children. And then proper regular checkups has to be done for a growing age. The adolescent females, they should be advised proper hygiene and taking care of themselves while menstruation.